on average, 130 Americans die every day from opioid overdose. And tonight, the root of that issue is a subject of a Fox Nation investigation. Watch.
The opioid crisis is the public health and safety crisis of our lifetimes.
In Huntington, West Virginia, the Guard has been called in to help tackle the opioid crisis.
Pennsylvania has seen around 10,000 overdose deaths in the last 2 years, prompting Governor Tom Wolf to declare a statewide disaster emergency.
Americans are more likely to die from an opioid overdose than in a car accident.
We're talking about a situation where doctors are primarily responsible because they wrote the prescriptions, but drug manufacturers applied them and pharmacists went along with it.
Purdue saw fit to exchange destroyed lives for financial gain.
In Ohio, the coroner of one county says at least 10 people died of drug overdoses there in the past 26 hours.
Drug overdose deaths rose by more than 20% from 2015 to 2016 and is expected to climb even higher. Dr. Drew Pinsky, addiction medicine specialist, featured in Fox Nation's America's Opioid Conspiracy, joins me now. Doctor, good to have you with us. There's a $50 billion settlement that's being worked on by three, I believe, of the drug giants that we may be getting word of any minute here. But talk to me about why you say that the medical institutions and the business that you have spent your life trying to help people in is at the core of this problem.
We absolutely were at the core. We developed a discipline where pain became the fifth vital sign. Literally, think about this. Institutionally, state medical societies, Joint Commission Hospital Accreditation required us to pay the same attention to pain assessment as your pulse. Think how ridiculous that is. And if we didn't adequately treat pain, we would go to possibly prison or be fined, not malpractice. Well-meaning patient advocacy groups got together with attorneys, and doctors were going to jail. This sent shockwaves through the system. At the same time, there were disciplines that took the position that pain is whatever the patient says it is, and pain control is whatever the patient says it is, that there should never be pain again, and that there's always been a solution, which was the opium-related drugs, and we just weren't giving enough. And I, at the time, for 15 years, was saying, hold on, this is crazy. My patients will die because of this, and they did.
It really is. You know, you think about if you visit someone in the hospital, right? They have the smiley faces, like, tell me if you feel good, or are you in a little bit of pain, or a little bit more pain? And I don't remember that from when I was growing up, right? So there's this whole idea.
It wasn't there.
It wasn't there, exactly.
It was a new thing. It was a new thing that said that assessment, that little smiley face thing was as important as the doctor coming over, the nurse feeling your pulse. Yeah. That's crazy. That was crazy. And we not only did we all adopt it and buy into it, we were required by legal pressure, by state medical societies, Joint Commission, to focus that way, to the point where 90% of the opiates on earth were being prescribed by my profession here in the United States. Yeah. We did it. We did it. We did it in the 19th century as well. There was a previous opiate epidemic in the 19th century, almost identical to this, and the same thing happened.
You know, I mean, I think of, getting my wisdom teeth out, right? And they send you home and say, it's going to hurt for 3 days. It's going to hurt because you just had surgery in your mouth. Now it's like, if your child feels pain, give them this. And then if it still hurts, give them more of this. And it's just the whole culture of thinking that people shouldn't, you don't want people, I mean, obviously for cancer patients, it's a different category, but I'm talking about some of the entry-level pain that led to some of this. Is that incorrect?
Right. Oh, no. So you would have gone home. This is like even maybe as long as a year and a half ago, you would have gone home with 30 or 60 Vicodin, Lortab, or OxyContin in your hand. We were being urged to do this, to give the patient as much as possible. Again, my patients were dying. The addicts were dying. But we now we've gone the other way, where people with cancer pain can't get their opiates. So we've got to hit this right, and we got to let well-trained physicians that understand addiction and understand chronic pain to be driving the ship, not the attorneys, not the patient advocacy groups, not the state medical societies, but really the well-trained professionals who are there taking care of the patients.
And in your show, Celebrity Rehab, how did you see this play out?
Several of our patients, now I think people understand, several died because I got them off opiates. They were doing well. Mike Starr from Alice in Chains, a perfect example of this. He was a lifelong drug addict. We worked with him for a year after what you saw on Celebrity Rehab. He moved to Utah. We discouraged him from that. He went anyway. We stayed in close touch with him. And he called me one day and he said, "Doctor, I'm having back pain." I said, "Mike, please don't tell a doctor. Whatever you do, don't tell a doctor." 2 weeks later, he was dead with a bottle of OxyContin and benzodiazepine at his bedside. My patients were routinely killed, and it was so painful and so difficult to live through that time. Now we've cut off everybody from their opiates, and they're going to the street rather than calling them in and saying, "Hey, we made a mistake. We got a second problem here now called addiction. Didn't mean for that to happen. Let's go treat it." Instead, we say you're a bad patient, and of course, those patients now go to the street. And now the big problem is fentanyl and heroin.
Indeed it is. Dr. Drew, thank you very much. The documentary on the opioid crisis is on Fox Nation, America's Opioid Conspiracy. Thank you very much, Doctor. Good to see you tonight.
Thanks.
Coming up next, a story exclusive that you do not want to miss.